Good morning. Calling to order the Board of Health meeting. Today is Wednesday, March 19th. It's 8 o'clock. Minutes of the last meeting were distributed electronically. Are there any amendments?
No amendments?
No amendments.
Hearing none, I'll take a motion to accept the minutes as written. Ms. Rosacci?
Aye.
Okay. Ms. Walker?
Aye.
Second. All right. We'll motion to vote. Ms. Rosacci?
Aye.
Ms. Walker?
Aye.
Abraham votes aye. The minutes are unanimously approved. We have created a public comment policy, policy number 1, which was posted on our website and copies were distributed. Our board has had a chance to review the public policy. This is to allow members of the public to offer comments on issues that they find important. There are specific rules and regulations around that so as to set some limits and guidelines. And we would plan to do this approximately once a quarter. We will make a decision about when we will have our first hearing. We will give advance notice so that people who want to offer an opinion can come here and do that. This will not be a discussion or debate, but simply an opportunity for the public to offer comments on any issue that they consider relevant to bring before the Board of Health. Are there questions about any of the aspects of this policy?
No, I had no
All
questions.
right, if
No, no
not,
question.
we'll entertain a motion to accept policy as written. Ms. Rosacci?
I make a motion to accept.
Okay, thank you. Second?
I will.
Second. All right, motion to vote. Ms. Rosacci?
Aye.
Ms. Walker?
Aye.
Abraham votes aye. The policy is accepted. And we will determine at a future date when we will be able to have our first hearing, and anticipate approximately once a quarter to be able to hold such hearings for about 15 minutes, with give an opportunity for about 5 members of the public to testify at about 3 minutes each.
Mr. Chair, could we please establish an effective date for this policy?
We can make that effective immediately.
Okay, if that's
Is
what's
the-
agreeable
is
to
the
the board?
Yes.
Board agreeable?
Yep.
Yes, the board unanimously agrees that the policy would be effective immediately. Thank you, Ms. Stockwell.
Thank you very much.
All right. So with that, we'll move on to the communicable disease update. Ms. Houghton?
Thank you. Good morning to the chair, to the board. I'm Amelia Houghton. I will give you the nursing report for communicable and infectious diseases. So we've seen a slight increase in reported flu cases last month from the previous month, with 125 cases in January compared to 141 cases in February. Numbers of reported COVID cases, COVID-19 cases, seem to be going down at the moment, with 25 cases being reported in January compared to 16 in February. Other vaccine-preventable communicable diseases, there were no measles or pertussis cases in February for Shrewsbury. And as we report frequently, the World Health Organization recommends that individuals in areas where it is winter take normal precautions to prevent the spread and reduce risks posed by respiratory pathogens, especially to the most vulnerable. People with mild symptoms should stay home to avoid infecting other people and rest. People at high risk or with complicated or severe symptoms should seek medical care as soon as possible, and individuals should also consider wearing a mask in crowded or poorly ventilated environments. Just a quick note on national outbreaks. Currently, we are still dealing with avian flu, measles, and norovirus. They still continue to draw attention nationally and globally, and we have reported on these diseases previously. However, I just want to mention again, give more attention to measles, since the outbreak is spreading to more states now. So the new information as of March 13 is that a total of 301 confirmed measles cases were reported by 15 jurisdictions, 15 states: Alaska, California, Florida, Georgia, Kentucky, Maryland, New Jersey, New Mexico, New York City, New York State, Pennsylvania, Rhode Island, Texas, Vermont, and Washington. This is per the CDC, and at least 50 of those cases have been hospitalized, with 1 confirmed death and 1 death under investigation. And this is as of a few days ago. So to wrap up the measles report, as previously reported, 2 doses of the MMR vaccine, which is measles, mumps, rubella, is still recommended for providing the best protection against measles for children, teens, and adults as well. 2 doses are 97% effective, according to the CDC. And, of course, laboratory confirmation is essential for all measles cases. So you must see a provider, and testing must ensue in order to confirm that a person actually has measles. And all of this and more can be found on the CDC website called Clinical Overview of Measles /measles rubiola /CDC. That's it for my report.
Great. Thank you, Ms. Houghton. Questions?
No questions? No.
Okay, great, thank you. Then we'll move on to the Central Mass Regional Public Health update. Mr. Vance?
Good morning. I'll be providing the environmental health updates. Since our last meeting, we did receive 2 complaints from general food complaints. One at Trader Joe's regarding quality concern. The complaint was unfounded. At the time of the inspection, there were no other items that had any issues. And then Imperial Buffet had a concern of the sanitary practices of the overall establishment. So we did discuss that with the manager on duty, and it did prompt a routine inspection, so we conducted that at the same time. We did receive 2 foodborne illness complaints as well, one for Terra Brazilis over in White City. I did have some concerns on proper temperature holding and cooking of temperatures, so I am going to be following up with them to make sure that they're implementing the right education for staff. And then Hooters as well came in just this week. That complaint was also unfounded. They had good sanitation practices, no reported employee illnesses, and good temperature holdings over there as well. And we have successfully finished up the health plan review for the ground round and conducted their pre-operational inspection, and they're targeting an opening date at the end of the month, so they'll be up and running as well. And that, I believe, is everything that I have to report.
Great, thank you. Right, our next meeting is on April 30th,
Yes.
I believe. Yeah. All right. Are there any agenda items anybody else needs to bring up?
No,
Take a
no
motion
additional
to adjourn.
items.
All right, motion to adjourn.
Motion.
All right, second.
Second the
All
motion.
right, vote, Ms. Rosachi,
Aye.
Ms. Walker,
Aye.
Abraham votes aye. The meeting is adjourned.
Thank you.
Thank you.